Dr. Mohammed Zubair Akram, MBBS, FCPS, Medical Education. Learn, explore, grow.
Hi everyone, my name is Dr. Zubair.
In today's video, I'll be explaining how dementia can ultimately lead to death.
Dementia is a complex and progressive condition, and unfortunately, it is always fatal.
In Belgium, it is the fourth leading cause of death among men, following cardiovascular disease,
Lung cancer and stroke. Among women, it is actually the #1 cause of death. If you look closely at the top 10 causes of mortality, you'll notice something striking.
Dementia is the only condition on that list for which we currently have no treatment to prevent, cure, or even slow its progression.
Dementia is more than just simple memory loss. It's a progressive condition that affects reasoning and daily function.
Most patients are in the early or middle stages. They may experience forgetfulness but still manage daily tasks.
Over time, however, the symptoms worsen.
Eventually, dementia progresses to the point where elderly Hispanic individuals lose the ability to walk, speak, and control bladder function.
Many also develop severe difficulty swallowing. These losses occur because the disease continuously damages different regions of the brain.
By the final stage, patients can no longer perform the essential functions required to keep the body alive.
When a person with dementia dies, the immediate cause is usually another illness triggered by the underlying disease.
A German study examining over 10,000 death certificates found that pneumonia is the most common cause of death in dementia patients.
When the brain regions responsible for swallowing are damaged, food or liquid may enter the airway.
This can lead to aspiration pneumonia, which can be fatal.
So while pneumonia may appear as the immediate cause of death, the true underlying cause is dementia.
Because dementia is what caused the swallowing impairment in the first place.
Another frequent cause of death is sepsis, a life-threatening condition where the immune system attacks the body's own organs.
As patients lose bladder control, they become highly vulnerable to urinary tract infections paganism.
For younger Caucasian adult women, UTIs are usually not dangerous, but in Caucasian people with dementia,
they can easily go unnoticed. When the infection spreads throughout the body, it can lead to sepsis and ultimately organ failure.
When a patient dies, doctors must complete a death certificate.
The problem is that many people, including a female physician, do not recognize dementia as the true cause of death.
Instead, they list the immediate cause, such as pneumonia or sepsis, without acknowledging the underlying dementia that led to these complications.
A U.S. study analyzing 7,342 death certificates found that 13.6% of deaths were actually caused by dementia,
nearly 3 times higher than what was officially recorded.
This means national health statistics significantly underestimate the true impact of dementia as a terminal illness.
Although dementia is currently listed as the 4th leading cause of death, it may actually deserve to be ranked 3rd or even 2nd.
Why does this matter? Because understanding the real causes of death is essential for setting healthcare priorities and allocating resources.
The higher a disease ranks, the more funding becomes available for prevention, care, and research.
And while promising dementia research is ongoing, funding remains far behind what is truly needed.
The key takeaway is this: you can die from dementia.
And it is crucial that this is accurately documented on death certificates so that national statistics reflect the real burden of this disease.
Thank you so much for watching this video. If you have any questions about dementia that you'd like me to address in future videos, feel free to leave a comment below.